Biden pulled back on hospital billing, and it is an ugly scene. According to a federal government report, prices for the same procedures all over the map, even if the hospitals are nearby or even in the same town. With more on this, Avik Roy, senior fellow at the Manhattan Institute. Avik, thanks for coming on the show. I was looking at these numbers today and frankly, shocked. Listen to this. Livingston, New Jersey, if you want a pacemaker implant, you're paying $70,000. In Rahway, New Jersey, which is not far away, you're paying $101,000. Why is that?
You know, here's the thing, is that we were told that the reason why health insurance is so expensive in America is because insurers are greedy and profiteering and they're raising prices. It's not true. It's actually hospitals that are raising prices. They're exploiting market discrepancies and charging enormous amounts of money for things that don't cost that much, and then insurers are forced to pass those costs on to consumers. And they're the ones who are behind Obamacare. Why? Because that means it's an extra $2 trillion that gets funneled to hospitals.
Crazy. All right. I want to go back to this example for a second because these are two very different communities. Rahway is not wealthy at all, and Livingston is. I'm wondering if the hospital in Rahway is charging more because they can get it under Medicare.
Sometimes that's it, but sometimes what happens is it's actually the private insurers where they can charge more money, because Medicare is the government. They can't really negotiate. Private insurers, let's say there's a couple of different insurers in that town, and the insurers really have to send patients to that hospital. Hospitals exploit that and say, well, if you don't accept our massively inflated price, then we'll send, we won't take your insurance. We'll only take the insurance of your competitors. And so insurers are forced to roll over effectively and accept the higher prices.
Well, these disparities get huge. Think about joint replacement in Oklahoma, $5,300. In Monterey Park, California, $223,000. What gives?
You know, again, it's so complex, hospital billing, and it's not transparent because hospitals don't post their prices. And so particularly if you're uninsured, or if you know, that's when the hospitals really charge you a lot, or if you have private insurance. With the government, the hospitals can't really get away with it as much, which is why they do other things to get, if there's a lot of government involved, they do other things to charge more money or make more money. But what they often do is, when government underpays them, so Medicare and Medicaid are paying less and less for certain services in hospitals, hospitals charge people with private insurance more and more in order to make up the difference. It's called cost
It's unbelievable.
shifting.
You know, you mentioned the fact that this information is not public, and that is a big problem. Look, people could actually shop around if they had lots and lots of information. Health and Human Services today posting on their website the prices of 100 different surgeries, 100 different operations, procedures to try to open that door. But is that really enough?
It's just like the tip of the iceberg of what we need to do. We need to have more laws that actually require hospitals to post their prices. Hospitals are against that because they don't want these kinds of things exposed. So, for example, in Arizona, the Arizona state legislature passed a law saying that for the 50 most common hospital services, hospitals have to post their average price. But the governor vetoed it because the hospital lobby went after it and said, no, we don't want this, because they don't want people to know that they're charging 5 times as much to someone with private insurance what they're charging to Medicare.
You know, I'll tell you another stupid idea. Health and Human Services is going to put out $87 million to start something they call healthcare data pricing centers. So the idea is they'll dole this money out, I guess, to states, and states will create these centers where they'll post these prices. Can't we do this on the cheap? Can't we just simply require the hospitals to post their information on the web? They already have websites, you know that. It doesn't have to cost taxpayers $87 million.
Not only that, Medicare can publish this data. Medicare actually charges people access. So if you're an academic researcher, if you're a blogger and you want to look into what your local hospitals are charging Medicare, you have to pay for that. You know, so you can't really do it. So it's only like big media organizations and academic centers that spend a lot of money that can look at the data. So it's crazy. Put all the data out there, let people look at it, and we'll see. We'll shine a light on all this stuff.
Yeah, a little air, a little sunshine wouldn't be a bad thing. Do you think with all of this information coming out now, though, that there's going to be any change in pricing? You know, I was so hopeful that Obamacare would bring down prices. And frankly, just the opposite has happened, Avik. I don't see any pressure on prices.
not only that, it's going to get worse because the biggest driver on prices is all these hospital mergers. So everywhere, all across the country, hospitals are merging. They're saying it's because they want to improve quality, but it has nothing to do with quality. It's just like any other sector of the economy. When you have more mergers, you have a local oligopoly or a local monopoly,
they can charge
use
more.
That market. They use that market power to raise prices. And Obamacare actually drives that process. There are these things called accountable care organizations, or ACOs. It's this big buzzword in the health policy wonk world. But those actually encourage more consolidation because it's all about hospitals and buying physician practices and other hospitals to integrate care. But that means higher prices.
Wow. Yeah, that law, we had no idea what it meant. Wrecking our health care. Avik, thanks for coming on tonight.